Okay, anterior torso. So remember, front of the body is anterior, back of the body is posterior. So we're going to work primarily on, we're going to start with pec major. Begins on, um, the My Anatomy app has a beginning, yeah, on the clavicle and the sternum, right? So the clavicle is the big collarbone, and then the sternum is the line of cartilage between the two sides of the ribs. So pec major begins here, comes up on this angle, and inserts on the intertubular groove of the humerus, very close to where latissimus dorsi inserts. So what does it do? Pec major, you can track the insertion back towards the origin, will do this, which is adduction of the arm. It also, if the arm is extended, it will bring the arm across the body. And it will also do internal rotation of the humerus because it's on that angle, so it will rotate. Okay? So we can see pec major. I still think the best way to see pec major is to have the person reach for the ceiling. Okay? That's all pec major right there. Okay? Relax. And I have gotten consent from my client that I'm allowed to touch his chest. Make sure you get consent, whether it's male or female. You want to make sure you have consent. Some people get real touchy about it. Pec minor begins on the third to the fifth rib and inserts on the coracoid process of the scapula, which is all the way up into here. So it sits kind of like this. For those of you who've had me before, I'm a visual teacher and a visual learner. That is basically what pec minor looks like. Pec major comes across, pec minor sits like that. There are three distinct heads of it. It's always treated as one muscle. It draws the scapula forward, down, and inward. Okay? Pec minor. It technically just moves the scapula, but it's also involved in a lot of other things that the pec major does, like press, external rotation. There's all kinds of things that pec minor does. 4 abdominal muscle groups to talk about. The superficial one is rectus abdominis. It begins all the way down here at the very top of the pelvis, which is called the pubis. And it inserts onto the costal cartilage of the ribs 5 through 7 and the xiphoid process of the sternum. Okay? So this is all rectus abdominis. What does it do? It flexes the spine. Okay? The easiest thing to think about is doing a sit-up, right? Come up. That's rectus abdominis. Thank you. It also, if it functions just on one side, if it fires unilaterally, it will do rotation of the spine. Bilaterally, it does flexion of the spine. This is a core stabilizer. Transverse, so if I take a scalpel and I cut rectus abdominis off, the next muscle down is transverse abdominis, which looks like a girdle. It looks like a support belt. It's a very difficult muscle to isolate, but it begins on the inguinal ligament, the iliac crest, and the cartilage of the lower ribs. It inserts on the linea alba and the crest of the pubis. Its primary function is to compress the ribs, which helps with exhalation. But I believe its primary function is actually core stabilization. The transverse abdominis is basically like a girdle. And without the transverse abdominis working well, nothing in the core works well. Obliques, the external obliques, sit like this. They begin on the lower 8 ribs. They insert on the iliac crest and the inguinal ligament. And their primary job, remember on oblique angle you're going to do a rotation, they are going to rotate and flex the spine. So if they fire together, they're going to help rectus abdominis do the flexion. When they fire unilaterally, they're going to rotate the body that way. Okay? Remember that muscles never push, they only pull. So this muscle, as it contracts, the right side will rotate him away. The internal obliques begin on the inguinal ligament and the iliac crest, insert on the linea alba and the inferior ribs, so it comes up and in like this. Its job is same side spinal rotation. So when transverse abdominis fires, it rotates the spine in one direction. The obliques do the opposite. Psoas, one of the longest muscles in the body, begins on the transverse processes of T12 through L5. It's basically right in there. It's deep, it's on the spine, so it's actually all the way in like that. And it inserts, remember this big bump out here on the femur is called the greater trochanter. This is the lesser trochanter. There's a small knot, a knob right there on the inside of the femur. So psoas comes like this, meets up with the iliacus, and comes down and inserts on the lesser trochanter. It is a long muscle. In my opinion, it is not a powerful muscle. When clients come to you and say that their psoas is killing them, don't just dig in and loosen it. Sometimes the muscle is sore because it's overworked, but it's actually weak. If you loosen a weak muscle, you're going to make it weaker. So there's muscle testing we can talk about at a later time. Origin, insertion. Contract the insertion back towards the origin, and you will see that psoas is a hip flexor. Because of this angle, it also does internal rotation and a deduction. Okay? In my opinion, psoas is much more of a core stabilizer muscle than a powerful mover. It does flexion, a deduction, and internal rotation, but it's only an assistant in all of those. It is not the primary in any of them. For deep tissue, I rarely do abdominal work, but if a person is having spasms or they've done a lot of core work and they're just really sore, you work like any other muscle. You just have to be careful not to go in too deep. You don't want to poke into organs, but there is no reason that you cannot work on abdominals. Again, just get consent. If the person, if I have a sheet over this person, you have to get consent to touch anything that's underneath the sheet, whether you're going through it or coming up underneath it. Just make sure you have consent. That's always discretion is always the better part of valor. So with abdominals, if he was telling me that he was having pain, right? So there's a spot right there is that sore?
It's tight, I know it is.
Okay, so this is tight. We don't know why. It's not causing many pain, but as I knuckle around in here, it's at least a little bit sore. So I'm just going to kind of hang on to that, have him breathe a little bit, and then as he exhales, see what my hands did? I follow him in. Perfect. Now I'm getting a twitch, and it's a nice steady beat, so I'm going to get off of that. That tells me I've got an artery. Okay? If you get into a muscle and it twitches and jumps, that's fine as long as it's not hurting the client. But if it's a nice steady rhythm under your fingers, it's probably an artery and you want to get off of it. So I'm not going to go any deeper than that. You can also come up underneath the ribs and get into diaphragm, which is a major breathing muscle as well as an enormously powerful core stabilizer. One thing to remember with abdominal work is no matter what direction I work, always finish with this movement, okay? Never go the opposite direction. This is the way the intestines flow, okay? So this is the ascending colon, transcending colon, descending colon. This is really, really important in infant massage in particular. You really want to make sure that a baby can eliminate. Baby's main responsibilities are eating, sleeping, and pooping. And if they do all three of those well, it's a much happier house. And this is a great way to help a baby, or anybody actually, if you're having constipation yourself, do that movement nice and slow. It is not a deep tissue move, just nice and slow and easy in that direction, and you will encourage the system to evacuate. Pec. You're going to spend a lot of time working on pec. Again, if this is a female client and I've got a sheet, that sheet is my contract with the client. I do not ever go underneath a sheet. I will, if this is a female, I will use the edge of my hand, never like this, and rarely with my fingertips. I use the side of my hand so she knows exactly what I'm doing. This could not be any less erotic, using the side of my hand into a pec muscle, right? Just protect yourself. Make sure you're not working into breast tissue. If this is a very large-chested woman, you kind of have a discussion about it. Look, I'm gonna get underneath this tissue into the pec muscles. As long as she knows what you're doing and gives you consent, you're good, okay? Don't just jump in and say, okay, well, I need to work on that muscle. If she's not comfortable with it, don't do it. And there are some men that don't want this area worked on either. So make sure you get consent. For pec major and minor, I always use movement, right? So I'm going to strip. This is pin and stretch actually, right? I'm just going to dig my hand in like that, and then I'm going to pull the muscles right out from underneath my hand as I do that stroke. Come all the way to the attachments, okay? There is plenty of research that says that you can affect the entire muscle if you only work on the tendon. It's not as deep, it's not as powerful, but if the client is just either really sore or really sensitive and doesn't want any work in here, you can just work on the clavicular attachment all the way out underneath into the medial humerus where it attaches. Just follow the tendons, okay? You can, if you can get into here safely with their consent, work along the sternal ridge, okay? But you can get a lot of work done right out here in a nice safe area with some nice rotation, some elevation. So pin and stretch, strip, ascending, transcending, descending colon, pec major, pec minor, rectus abdominis, transverse abdominis, external obliques, internal obliques. Okay, I think that does it.